Well, I wanted to thank Dr. Burgess. Always great to hear him and always learn a little bit more when he has an opportunity to talk. So good morning, and I want to thank you all for being here, for being part of this conversation. Over the past 2 years, navigating the public health crisis, patients are abundantly aware of the hurdles that they face in getting health care. Level ground, I believe, is a fitting title for today's conversation because it's exactly what is needed in order to assure equity in the healthcare marketplace. My name is Bob Dold, and I'm here today on behalf of AIR340B. It's a coalition of patient advocacy groups, clinical care providers, and biopharmaceutical innovators. As a former member of Congress, I've spent tons of time outside of Washington, D.C., visiting with patients, with hospitals, and those that need government services. Patients who count on those services to work as they were originally intended by the United States Congress. The 340B program was built to support low-income and vulnerable patients through a system of safety net healthcare facilities in medically underserved areas of our nation. Unfortunately, the vast majority of those hospitals, their child sites, and affiliated contract pharmacies are located not in those areas, but in affluent areas, rather than in the communities that need them the most. Our coalition advocates for fixes to the 340B program that ensure that it works for patients. And the majority of voters agree with that sentiment. Hospitals and pharmacies should not be profiting off of safety net programs intended to help the low-income and vulnerable patients of our nation. The 340B program can play an important role in advancing health equity. But I believe that we need to reconsider the eligibility standards for the medical facilities that participate in the 340B program. That, coupled with increased transparency and oversight, will help prevent further abuse from hospitals and pharmacies. In fact, just today, we're launching a new tool, an explainer of sorts, to help Congress and policymakers better understand the issue, because that's what we need. We need them to understand the issue that we face today and how important it is for America's patients. So here is a preview for you to view.
How can we better advance health equity? Improving an existing safety net program called 340B is one critical step. 340B was created to help low-income and uninsured patients access life-saving medicines. Through the program, manufacturers provide medicines at significantly discounted prices to participating hospitals and clinics to help them provide medicines to vulnerable patients. However, a recent report on 340B and health equity finds the majority of 340B disproportionate share hospitals, or DSH, their child sites, and affiliated pharmacies are not located in medically underserved areas. These are areas that most need improved access to care for vulnerable populations, like communities that have too few primary care providers, high infant mortality, high poverty, or a high elderly population. Only 38% of 340B DSH hospitals and less than a third of their child sites and pharmacies are located in these MUAs. This is a missed opportunity for 340B, a federal safety net program, to truly advance health equity so everyone has the opportunity to attain his or her full health potential, regardless of socioeconomic status or circumstances. Policymakers need to hold those utilizing the 340B program accountable to ensure only true safety net facilities serving vulnerable communities can participate. This would help restore 340B to its original purpose and target the billions of dollars in discounts to directly help low-income and vulnerable patients access their medications, instead of lining the pockets of hospitals, for-profit pharmacies, and other healthcare facilities. Learn more at 340breform.org.
So I want to thank you all for being part of today's conversation and helping advance the issue of health equity. And I also want to offer, if you have other issues, questions, concerns that we can answer, please reach out to the AIR340B Coalition. Thanks so much for being here.